Lutheran Social Services of North Dakota announced that they will be suspending their programs and begin the process of closing and filing for bankruptcy if necessary. Now, new this morning, Nikki Johnson, she met with the people in charge of the changes for thousands in our state. Good morning, Nikki.
Good morning, Alicia. Lutheran Social Services has touched the lives of vulnerable individuals and families in need in our state, and now they're needing help to transition smoothly so none of their clients fall through the cracks.
Last year, Lutheran Social Services of North Dakota provided healing, help, and hope to more than 24,000 people across the state. They are affected. The families of our 283 employees are affected.
For 106 years, Lutheran Social Services provided services to children and adults needing treatment for things like substance abuse or gambling or housing assistance. And recently, the LSS housing affiliate drained the resources of the larger agency, creating financial pressure. Otterson says he never saw the shutdown coming.
The agency had some financial challenges that I was aware of when I came in the door. I would not have predicted this outcome 51 days ago. I would not have predicted this outcome 10 days ago.
And it wasn't necessarily the pandemic's fault. In 2009, when the housing program began, the oil boom created the need for affordable housing in the western part of the state. Since finances in oil stopped rolling in, LSS began to feel the pressure. This
nonprofit established a budget for the current fiscal year of approximately $19 million in both revenues and expenses. However, certainly the pandemic affected the ways in which our professionals could deliver their services. Secondly, a decrease in oil production within the last year put yet more stress on the housing system. The ability of our people to deliver their services around all of that became compromised.
Since then, Lutheran Social Services has relied on several state organizations to help take on some of the program services during this transition. The North Dakota Department of Human Services is one of them.
Well, in some ways, these are some of the most vulnerable individuals in the state. And we contract with a number of different agencies to provide these services. So a lot of the services that are provided for the clients that LSS or Lutheran Social Services served just don't have access to the basic social determinants of health.
Jones says these services provide clients from going into deeper crisis and in some ways are an early intervention so people can be successful. And both men agree there is hope for the clients, hope for the families, and hope for the employees.
We have to stay focused on the positive and treat this as an opportunity to continue to evolve.
Over the course of the next few weeks, state agencies will help contribute to the transition of hundreds of LSS employees and thousands of clients. Alicia, it's comforting to know that these individuals and families will still be getting the help that they need because other agencies are stepping up and lending a hand.
That's going to be a lot of work, definitely, but it is good that they are working together to make sure that everybody's taken care of. All right, thank you very much, Nikki.